kind of.
So what would you say would be, I don't know, some of the main pieces of advice you would give to folks, because we're in that age now where our parents are getting older, and what would be your some really important points for people to know or start thinking about in terms of preparing for this?
I think for me, you could look at long-term care insurance. In the old days, our parents and their generation, they had long-term care insurance that covered everything. But that led to the collapse of the long-term care insurance market.
Oh.
And so today, there's only a handful of companies that have long-term care insurance, and they don't cover everything. So I think it helps, though, because most people don't go from home to nursing home in one step. It'll usually be sort of an incremental fashion. So they come home, but you need to hire daytime caregivers or nighttime caregivers.
I'll say that, caregiving is really hard.
It really
I think that's the main thing, which have found that caregivers for patients with dementia have an increased risk of death. And that's higher in younger and middle-aged caregivers. So that's kind of the sandwich generation that has kids and jobs and taking care of an older. So I think, to answer your question, I think talking as a family about kind of the what ifs. We all hope for the best, but we have to be prepared for the worst. And chances are, if you live long enough, you have a significant chance. I think cumulative risk after age 50 is like 44% of getting dementia. So